Hello and welcome to another in our series of community talks brought to you by the Center for Asian Health Research and Education, CARE for short, at Stanford, as well as the Stanford Health Library. My name is Bryant Lin, and I'm very pleased to welcome you today to our fantastic talk on hepatitis B in Asian Americans, what you can do to lower your risk. I'm very, very happy to welcome my colleague and great friend, Dr. Samuel So. Samuel So is really an inspiration for us all, and he is one of the inspirations for us starting the Center for Asian Health. We're really standing on his broad shoulders when we started our center based on his excellent work. Dr. Samuel So is the Louis Hock Minh Professor and Professor of Surgery at Stanford. He's also the founder of the Multidisciplinary Liver Cancer Program at the Stanford Cancer Center, and the founder and executive director of the Asian Liver Center at the Stanford University School of Medicine. Dr. So is a native of Hong Kong and received his surgical training at the University of Hong Kong and the University of Minnesota, where he also completed his fellowship in multi-organ transplantation. His current clinical area of specialty is a multidisciplinary approach to the treatment of primary liver cancer and the management of chronic hepatitis B infection. He is listed among the best doctors in America. Dr. So is recognized worldwide for his expertise in chronic hepatitis B and primary liver prevention, research, treatment, and health policy. So I really am very pleased to welcome Dr. So to our community health talks brought to you by the Vincent V.C. Wu Foundation. If you have any questions, please put them in the Q&A and we'll answer them after the talk. Please join me in welcoming Dr. So.
Thank you, Brian. Let me just share screen. First of all, I'd like to wish everybody a happy Asian American and Pacific Islander Heritage Month, and welcome all of you who are attending this talk tonight instead of watching the Warriors and LA Lakers game. So I'm going to talk about a problem, a liver disease, which is very common in Asian. And I think many of us probably know of friends or family members who have been affected by this problem. The disease I'm talking about is hepatitis B in Asians and Asian Americans. So what I would like to talk to you about is what you can do to lower your risks if you have hepatitis B, or if you are not aware whether you are infected by this infection. Hepatitis B is actually a major public health problem in the world. It is less well known than HIV, but it's actually impact more people in the world than HIV. The World Health Organization estimated before the hepatitis B vaccine was recommended for all newborns, 1 in 3 persons in the world would become infected with hepatitis B virus. An estimated 300 million people were living with chronic hepatitis B, and about 800,000 people died largely from cirrhosis and liver cancer caused by hepatitis B in 2019. Although the hepatitis B virus could infect anybody, over 50% of those living with chronic hepatitis B are people in Asia, and about 25% are people living in Africa. So if you go to most countries in East Asia, like Taiwan, Vietnam, or China, an estimated 1 in 8 to 1 in 12 adults living in those countries have chronic hepatitis B infection. The prevalence of chronic hepatitis B in India is a little less, is about 1 in 30. In the US, the CDC estimate that 1 in 12 foreign-born Asian and Pacific Islander Americans are living with chronic hepatitis B, compared with 1 in 70 US-born Asian and Pacific Islander, and compared with almost 1 in 1,000 Hispanic, and white American. If you combine the foreign-born Black American and US-born Black American, the prevalence is at 1 in 200. But mainly is because foreign-born Black American has as high a prevalence of hepatitis B as Asian Americans. Although Asian Americans make up only 6% of the US population, they account for over 60% of the estimated 1.5 to 2.5 million people living with chronic hepatitis B in the United States. So hepatitis B is recognized by the Office of Minority Health as a major health disparity between Asian Americans and white Americans. In a study, we estimated that in California, because of our large Asian population, about 89% of people living with chronic hepatitis B in California are Asian Americans. And this chart shows, it's even higher in San Francisco and in the Bay Area. Over 90% of those living with chronic hepatitis B in this Bay Area are likely Asian and Pacific Islanders. And because chronic hepatitis B is a major cause of liver cancer, it's not surprising that liver cancer, which is not as common in Black and Hispanic or white American, is the second leading cause of cancer death in Asian and Pacific Islander men. And because of our large Asian population in the Bay Area, San Francisco and Santa Clara counties are among the counties with the highest incidence of liver cancer in the country. So what is hepatitis B? Hepatitis B is caused by a virus called the hepatitis B virus. Is among the smallest virus in the world. It is actually not a new virus like the COVID virus or hepatitis C or HIV. It's estimated to be between 8,000 to 20,000 years old and has been identified in mummified children in both countries like South Korea as well as Italy. Hepatitis B is a major cause of death from liver cancer and liver cirrhosis worldwide. Every year, it takes the lives of 800,000 to almost 1 million people. It's 7 times more common and 100 times more infectious than HIV. And we call hepatitis B a silent killer because most of the people living with chronic hepatitis B have no symptoms until they develop late-stage liver cancer or liver cirrhosis. So how do people get infected with hepatitis B? Hepatitis B is transmitted in 3 ways. I always tell my students it's not BS, it's BBS. Is transmitted at birth from an infected mother to the newborn. And this is a major way Asians become infected with hepatitis B. It's also transmitted by infected blood through people reusing needles and syringes and from injection drug use, and also could be transmitted by unprotected sex. There are a lot of misunderstandings about how hepatitis B could be transmitted, especially in countries in Asia, and that has led to a lot of discrimination and stigma associated with people living with chronic hepatitis B. So hepatitis B is not transmitted by mosquitoes. is not transmitted by saliva or kissing or shaking hands, is not transmitted by sharing cups or eating utensils or by food or water, and not transmitted through casual contact in the workspace. And hepatitis B is not a hereditary disease. It's an infection that is transmitted, as I said, through mother-to-child transmission, through infected blood, and through unprotected sex. So at this point, I'd like to sort of tell you about the types of viral hepatitis. There are basically 5 types of hepatitis. Just think of them as the digits in your hand. Okay. Hepatitis A and B, like represented by your thumb and little finger, are transmitted by contaminated food and water. Okay, so a lot of people confuse that mode of transmission with hepatitis B. Okay, the one transmitted by contaminated food and water is hepatitis A and E. If you get infected with hepatitis A and E, it could make you sick, and some people can actually die from it. But if you, most people will recover, and it does not cause a chronic infection. It does not cause liver cirrhosis or liver cancer. The hepatitis A vaccine could be prevented with a vaccine. It's a 2-shot vaccine you receive over 6 months, and potentially it could protect you for life. So all the children growing up in California, most likely they all have been vaccinated against hepatitis A when they were children. Hepatitis E, that is not very common. It only occurs in certain parts of the world, and only occurs as an outbreak. And there's no FDA-approved vaccine, and it's not recommended to get the vaccine, which is the only vaccine which is available is approved in China. And even in China, they don't recommend routine vaccination for hepatitis E. So it's actually reserved for outbreaks when it happened in certain parts of the world. So what about hepatitis B, C, and D? So hepatitis B, C, and D could all be transmitted from mother to child at birth, from infected blood, and unprotected sex. But if you are protected against hepatitis B, you will not get hepatitis D. So if you are vaccinated against hepatitis B, you don't get hepatitis D, because hepatitis D can only exist in a person who has hepatitis B. So don't worry about hepatitis D at this time, because if you are protected against hepatitis B, you won't get D. So the danger of hepatitis B and C is they both can cause liver cancer and liver cirrhosis. Hepatitis B, as I said, could be transmitted to mother to child at birth. Hepatitis C can also do that, although it's less common than hepatitis B. And both of them can cause liver cancer and liver cirrhosis. But with hepatitis B, we have a vaccine, so it can protect you from hepatitis, from being infected. Currently, there's still no vaccine available to protect you from hepatitis C. In this country, the major way people get infected with hepatitis C is because people are injected injecting drugs. In the old days, when people don't know that there was a hepatitis C, and the blood for transfusion was not tested for hepatitis C, so people who had surgery over 30 years ago could have become infected with hepatitis C if they received blood transfusions. So what are the symptoms of hepatitis B infection? The symptoms really depend on the age when you become infected. So infected newborns and infants usually have no symptoms, but they are at the highest risk of losing the battle and develop a chronic infection. So as many as 20 to 90% of newborns who become infected from mother-to-child transmission or unsafe injections when they were little, they could develop this chronic infection, which put them later in life at risk. Usually, very often, 30 to 40 years later, at risk of dying from liver cirrhosis or liver cancer. If the person become infected as an adult, about a third of them will become sick with symptoms of fatigue, loss of appetite, or jaundice, which means yellow discoloration of your eyes and skin. And 1 in 200 may actually die from liver failure after they become infected. But most adults will eventually recover, although 5% to 10% can develop a chronic hepatitis B infection. So the risk of developing a chronic infection when infected as an adult is much lower than if newborns and infants become infected. And that's why the importance of universal newborn vaccination. Now, if you become infected with chronic hepatitis B, what are the symptoms? Actually, most people living with chronic hepatitis B have no symptoms until they develop advanced liver cancer or advanced cirrhosis. And even the blood tests for liver function at routine physical checkup can be normal. We call chronic hepatitis B a silent killer for that reason, because a lot of people don't know they have been infected. If you have chronic hepatitis B, it increases the risk of liver cancer by 50 to 100 times. And if left undiagnosed and not monitored for treatment, as many as 1 in 4 will die of liver cancer or liver disease. That is why, in countries like China, where as many as 80 to 90 million people have chronic hepatitis B, every year, over 350,000 people die of liver cancer, largely from untreated or undiagnosed hepatitis B infection. So how can you tell whether you have chronic hepatitis B when you go and get your checkup? Even your liver function could be normal. The only way to know whether you have chronic hepatitis B is get tested. Just like this billboard, when we launched the San Francisco Hep B Free campaign about 12 years ago, and you can see on this billboard, Gavin Newsom, who is now our governor in California, and Fiona Ma, who is now our state treasurer, were big supporters of the campaign try to eliminate hepatitis B at that time from San Francisco. The U.S. Centers for Disease Control and Prevention estimates that a third of the 1.5 to 2.5 million people living with chronic hepatitis B in this country are not aware they are infected. So really, every adult should get tested for hepatitis B. The test for chronic hepatitis B is very simple. It's often a 3-test panel, which tests for hepatitis B surface antigen. And if this test is positive, that means that person has chronic hepatitis B infection. The other test is called the hepatitis B core antibody test. And this test is useful in the sense it can diagnose whether someone has ever been infected. So if the hepatitis B core antibody test is positive, that means that person in the past or have been infected with hepatitis B or currently is infected with hepatitis B. And the third test is hepatitis B surface antibody test, which check you for whether you have immunity to hepatitis B, either because you were previously vaccinated or either because you previously got infected, but then recovered from your infection, okay? So as of last month, the US CDC, Centers for Disease Control and Prevention, recommends all adults living in the US get tested for hepatitis B. Because as I said earlier, about 1/3 of the people living with chronic hepatitis B are not aware they are infected. Well, in California, due to our advocacy, and beginning in 2022, all outpatient primary care clinics are required by law to offer their adult patients a hepatitis B screening test. And so, actually in California, hepatitis B screening is covered by all health plans, including Medi-Cal. And with if the doctor enter the appropriate screening codes, it's also covered by Medicare. So if you got tested, how can you protect yourself from hepatitis B if you are not infected? So if your hepatitis B blood tests show you have never been infected with hepatitis B and that you are not currently infected, you should protect yourself by receiving the hepatitis B vaccine. The World Health Organization called the hepatitis B vaccine the first anti-cancer vaccine because it protects you from getting infected with hepatitis B, which can cause a liver cancer. For adults, if you want to get vaccinated, you have a choice of 3 types of hepatitis B vaccine. You can get the traditional 3-shot hepatitis B vaccine given over 6 months. You can also get the more recently approved 2-shot hepatitis B vaccine that you take over 1 month. Or you can take a 3-shot combined hepatitis A and hepatitis B vaccine. Now, once you have received these full doses of the vaccine, currently the CDC have no recommendations for routine booster shots. Okay, so once you got vaccinated, you don't have to worry about getting booster shots. Now, note that the vaccine would not provide any additional benefits if your blood tests show you have hepatitis B or in the past was infected with hepatitis B. The good news now, hepatitis B vaccine for children and all adults are recommended by the Advisory Committee for Immunization Practices and are now covered by health plans, including Medicare Part D, with no out-of-pocket cost. So I'm sure when next time you see your primary care doctor, they will often now offer you to get your hepatitis B vaccine, in addition to asking you whether you have completed your COVID vaccines. So if you test positive for chronic hepatitis B, well, what can you do to reduce your risks? Well, I would suggest you consult your doctor or a specialist to see whether you should be taking antiviral medications, even if you have no symptoms. As I said, most people with chronic hepatitis B have no symptoms. Now, currently, antiviral medication is recommended for patients with active liver inflammation that can be detected by just your blood test for the level of ALT, or if for people who have liver cirrhosis. Nowadays, there's no need for doing a liver biopsy to see whether you need to be on treatment or not. Based on your blood test results, and if you have an ultrasound or abdominal imaging studies, it basically can tell whether you need to be on treatment or not. And the treatment is really simple. It's a pill a day, and there are two first-line antiviral medicine. One is called entecavir, and the other one is called tenofovir. Both are now very relatively inexpensive because they are now all can be supplied as generic drugs. Once you start treatment, you need to be on long-term therapy to suppress the virus. So just think of it, if you need to be on treatment, it's like getting treatment for high blood pressure. You take, and for hepatitis B is even simpler. It's just a pill a day, but it will suppress the virus, prevent further liver damage, and as a result, prevent or reduce the risk of developing liver cancer. The treatment is very safe and effective. It can even reverse people who have liver scarring and fibrosis and cirrhosis, and can prevent and reduce the risk of death from liver cancer and liver disease. So, if you need to be on treatment, there's no reason to delay getting treatment. And I just want to alert the public that to not fall victim to false advertising of curative therapy, because to date there's no cure for hepatitis B. But as I said, just like high blood pressure treatment, they are very effective treatment to suppress the virus, so you won't die from hepatitis B related liver cancer or liver disease. As a result of passage of the new law in California, beginning in 2022, healthcare providers are required by law to offer their patients or refer the patients with a positive chronic hepatitis B screening test for follow-up care and treatment. So it's important to know that whether you are suitable for treatment or not at this time it's important anyone with chronic hepatitis B be monitored for flare-up of the hepatitis and for disease progression and for liver cancer. So sometimes patients with chronic hepatitis B, when they first see their doctor, they would not have any evidence of active liver damage. But over time, with monitoring, then some of them will develop active liver damage. And at that time, treatment would be needed. So just because, most of the time your test results are normal, it doesn't mean that you should not continue to be monitored, because later in time, many patients will develop evidence of liver damage that require treatment. So monitoring is actually very simple. All it takes is get a blood test for what we call ALT level to monitor for liver damage, a level of alpha-fetoprotein to monitor for development of liver cancer, and every 6 to 12 months also get a blood test for hepatitis B DNA level to monitor for how active your hepatitis B virus is. So basically, is like most of my patients, that you only get a blood test every 6 months to make sure everything remains stable, and to see whether if you are not on treatment, whether you need to be placed on treatment if the hepatitis virus flare up. And especially for those with a family history of liver cancer and or they already have liver cirrhosis, that put them at much higher risk of developing liver cancer. For those patients, they should get an ultrasound of the liver to monitor for any development of a liver lesion in the liver that could represent an early liver cancer. So the American Association for the Study of Liver Disease also recommend any Asian men or Black men over the age of, starting from the age of 40 years of age, should get a liver cancer screening every 6 months with a liver ultrasound. And for Asian women over the age of 50, they should also get regular monitoring for liver cancer, because they are at high risk of developing liver cancer. So what else should you do if you have chronic hepatitis B? We recommend you avoid or abstain from regular alcohol consumption, especially in patients who already have liver scarring or liver cirrhosis, because alcohol could further damage your liver. If you have not been vaccinated against hepatitis A, you should receive the hepatitis A vaccine to prevent another virus from damaging your liver. So I always recommend patients to get vaccinated against hepatitis A, because most of us now travel around the world, and you could actually get infected with hepatitis A when you eat in some of these countries where the hygiene, in the restaurant may not be that great. Also, make sure your doctor knows about your hepatitis B status, and remind them to place you on antiviral therapy before starting cancer or immunosuppressive treatments that can potentially cause reactivation of the hepatitis B virus and potential risk of liver failure. So, it's at Stanford Cancer Center, since 10 years ago, they have accepted our recommendation. Any patient considered for chemotherapy, they should all be screened for hepatitis B to make sure their patients do not develop liver failure from reactivation of hepatitis virus. It's also important to know your rights. In this country, the law forbids discriminatory employment and admission practices based on a person's hepatitis B status. The reason I want to bring that up is several years ago, a medical school on the East Coast rescinded the admission of a student to medical school because he tested positive for hepatitis B. So as a result, the school was sued by the Justice Department, and since that time is well known that you cannot discriminate against someone because they have hepatitis B. The only place which still may have a problem is the military. I hear there are still instances that service members who were found to have hepatitis B were discharged because of their hepatitis B status. So hopefully that will change very soon. If you have hepatitis B, it's important to make sure every family member are tested, and if they are not protected, get vaccinated. Because as I indicated, the most common way Asians become infected is from a mother who's a hepatitis B carrier, which means actually people who have chronic hepatitis B, who transmitted the infection to the newborn in the days, especially when there was no vaccine available. So if you are over 30 years of age, there's a really good chance you were not vaccinated because it was not actually widely available to vaccinate newborns at that time. So most of the people nowadays who have chronic hepatitis B are over the age of 25 or 30 because they were not vaccinated because there was no vaccine available at that time. And if one family member, became infected, there's a good chance some of the siblings also could have become infected. So I know of some of my patients where, amount like, 6 or 7 siblings, and 5 or 6 of them, all of them also tested positive for chronic hepatitis B infection. So it's really important to protect the next generation from hepatitis B and liver cancer. You can do that by making sure newborns receive the first dose of the hepatitis B vaccine within 12 hours after birth. We call that the birth dose, and complete the vaccine series on schedule. And make sure babies born to mothers who are hepatitis B carriers, who have chronic hepatitis B, also receive, in addition to the vaccine, the hepatitis B immune globulin within 12 hours after birth to further protect them from becoming infected. And make sure pregnant women who are hepatitis B carrier during pregnancy receive blood tests to monitor for hepatitis reactivation. So you want to protect the pregnant women themselves from the hepatitis B infection. And for women who pregnant women with high viral load, it's recommended that they also receive antiviral therapy in their last 3 months of pregnancy to further eliminate the risk of the newborn becoming infected. So I'd like to tell you something about the Asian Liver Center at Stanford University. I founded the Asian Liver Center in 1996, thanks to a generous donation by Dr. C.J. Wong at his 80th birthday. The reason I founded the Asian Liver Center is to address the disproportionately high prevalence of chronic hepatitis B and liver cancer in Asians and Asian Americans at a time when no one seemed to be doing anything about it. As a liver transplant surgeon, coming to California, it just bothered me a lot that no one was doing anything about raising awareness about this issue and getting people tested, vaccinated, and treated. So the goal of the center is to address the gaps in hepatitis B and liver cancer awareness, research, and national policies with the goal of global elimination of hepatitis B and reduce the burden of liver cancer worldwide. To raise public awareness about hepatitis B, we borrow a page from HIV and use the color green or jade with a ribbon folded like a Chinese or Han character, meaning people, to unite people worldwide to end hepatitis B and liver cancer. We are very grateful to our donors, which allow us to have a great office and center on campus at Stanford University at the C.J. Wong building. Dr. Wong was very generous in donating a building to Stanford to let us have a home for the Asian Liver Center on campus. We are also very grateful to our donors to support our center in Beijing, which was established 10 years ago at the Stanford Center at Peking University. So, when I first founded the Asian Liver Center, people thought I was very crazy that how could you eliminate a disease which affects so many people worldwide? But it is really feasible to eliminate chronic hepatitis B as a major public health problem because we have a very effective vaccine and it's really inexpensive in most parts of the world that can end the transmission of this virus and prevent people from getting infected. So if tomorrow everybody in the world get vaccinated against hepatitis B, you will end end the transmission of this virus and prevent people from developing chronic infection, which can lead to liver cancer and liver cirrhosis. And nowadays, with a very effective antiviral treatments, even though it's not a cure, but it's very effective, as long as you take the medicine regularly, long-term, you can actually prevent virtually most of the deaths and illness from cirrhosis and liver cancer. And you can end disease stigma and discrimination by increasing awareness about how the virus is transmitted and by educating the public, which we have a very active program in China to do that. So as I said, 15 years ago in China, when I was interviewed by the China Newsweek, eliminating hepatitis B in China is not a dream, but it really, at that time, I encouraged the Chinese government to put more resources and investment in prevention of hepatitis B by making sure every child and infant are vaccinated against hepatitis B. So the CDC named viral hepatitis actually as one of the 6 winnable battles in public health in the US. So it's time to screen, it's time to treat, it's time to eliminate hepatitis B. So I'd like to end by showing you the slide that if you want to learn more about hepatitis B and how also you can help to support our work at the Asian Liver Center, please visit our website at liver.stanford.edu and at hepbmoms.org. So thank you very much for being with us today, and I'll be happy to answer any questions. Thank you.
Thank you so much, Dr. So, for such a wonderful, informative talk, and thank you so much for your service to the community. We have many, many good questions for you. I'll start with the first one from Sheila Wong, who's one of our fantastic care supporters and co-chair of our advisory board. She asks, what's the likelihood or probability of developing chronic hepatitis B if you get exposed, in particular in Asians? So if you have an exposure, what's your likelihood of developing chronic hep B if you're an Asian?
So as I indicated, it really depends on how old were you when you were exposed, right? So if you were exposed, or came into contact with the virus as an adult, okay, one out of 3 will get sick, but as I said, 1 out of 200 could actually die after getting infected, but most will recover, and only maybe 5% or 6% will develop the chronic infection, which can later on lead to liver cancer or liver disease. So, but it's a very different problem in infants and children because they are very prone to develop a chronic infection. Okay, and that puts them at risk, when they become adults, to develop liver cancer or liver cirrhosis. So the global bird initiative in preventing hepatitis B is universal newborn vaccination. So that's the pillar of the global response.
Fantastic. Yeah, just underscores the importance of having all babies vaccinated right after birth. Next question, it's a great question. Why is hepatitis B cure harder than hepatitis C? We've all heard about it, and you've touched on how we have these cures for hepatitis C. Why is it taking longer for the hepatitis B cure? And a caveat to that is another question was, how long will it be till we get a cure?
Okay, so hepatitis B is a DNA virus, and it's a very smart virus. Okay, it's so smart that it uses your liver to make baby virus, and it usually doesn't kill you right away. It just likes to live in your liver and keep on making baby virus, right? And it has a way to do that because it can actually, survive in the nucleus of your liver cells in a way that the drugs cannot get to it. Okay, so it's very difficult to really get rid of that part of the virus in the nucleus of the cell, which is not active. replicating, right? So, 5 years ago, people would say, oh, 5 years from now, we will have a cure. But that was 5 years ago. Now we say, oh, maybe another 5 years. so I wouldn't put my bet on it. And even a number of startup companies or even established pharmaceutical companies are trying to tackle this problem. And they are very honest. They are only trying to produce drugs which can actually, it's what we call functional cure. It's not a total cure. It just makes you lose that hepatitis B surface antigen, if you take the drug for 6 months, and they're shooting for a target of maybe achieving that in 30% of people who take the drug. So we are far away from finding a cure.
Far away from finding a cure and hard to predict the future, right?
But to me, I think it's naive to just wait for a cure when there are such effective drugs for treatment, so you don't die from it.
Right. Got to focus on what's important. Next question. I'm going to add to this next question. This one of the attendees is asking if you were infected, you have a core antibody positive, but now you're immune. Do you need to do anything different than somebody who, was never exposed? And then a corollary to that is, what if you have a core antibody positive and you're not immune? Your surface antibody is negative. What do you have to do then? So one scenario is you've got a surface antibody and core antibody, so you're exposed and you're immune. Do you need to do anything different than somebody who's not infected? And then you've got somebody else who's got a core antibody, but surface antigen negative and surface antibody negative. What do you do in those two cases?
So for the person who is core antibody positive and also surface antibody positive, that means that person got infected and then developed immunity, right? So that person probably have very low chance of having problems later on in life. Now, for those who are just core antibody positive, they could have been before surface antigen positive, and over time they lose their surface antigen, right? Or they have very low level of immunity. But anyone who are just core antibody positive, they are at risk for reactivation if they receive chemotherapy or some of these new drugs for treating inflammatory bowel disease or psoriasis, which suppress your immune system. So you're still, if you are core antibodies positive, if you sort of are going to receive chemotherapy, make sure the oncologist monitor you for reactivation of the virus. Okay.
Is there a role for vaccinating people who are only core antibody positive?
No, because that would not provide additional benefit. So CDC do not recommend vaccinating anybody who are core antibody positive.
Okay. And then a couple of questions related. I guess this audience member says that he or she thought that she had heard that chronic Hep B can kind of resolve itself over time. How often does that happen, and would an antiviral be appropriate in that case?
So basically, what that person mean is, over time, the person lose the surface antigen, right? The surface antigen was positive, and then over time, it becomes spontaneously become negative. So that can happen with age. And some people do that. They with age, they spontaneously lose the surface antigen, and it could occur it depends on, some people, the incidence could be as much as 1% per year over time, and but that, once you lose a surface antigen, it does lower the risk of that person developing liver cancer. But we still recommend to monitor those patients. I have some of those patients. I still recommend, just for safety, once a year do an ultrasound, just to make sure, because it's not totally sort of a zero chance, even if over time you lose your surface antigen.
Great. Another question asked about fatty liver. So if you have chronic Hep B and fatty liver, does that change the risk of liver cancer? And also, what's the prevalence of having both chronic Hep B and fatty liver in the Asian community?
Fatty liver is, becoming more common, but it's definitely not as common in Asians. It's basically, a problem of, we have too much to eat nowadays, right? and obesity. But if you have fatty liver, if you have chronic hepatitis B, and have fatty liver disease, or, it's just like if you have chronic hepatitis B and you have alcohol sort of a problem, I'm sure, I don't know whether there's the data, but definitely theoretically it would increase the risk of developing sort of liver cirrhosis and then liver cancer, because the major driver for liver cancer is if you develop liver cirrhosis, right? But in some patients with chronic hepatitis B, they can actually develop liver cancer without liver cirrhosis, which is very different from hepatitis C. Hepatitis C patients who develop liver cancer always have liver cirrhosis.
So we have time for one more question. We're not going to be able to get to all the questions, but this question, I think it's from somebody who had also emailed this question earlier, who seems to, I think, know your wife at MSS during school. She asks,
it's not my wife. It's not my wife.
It says, I'm Betty So's MSS classmate. Is it your relative? Your relative?
I think it's a distant relative.
Oh, distant relative. I see. Apologize. So she says, I have a 12 millimeter cyst on my left hepatic lobe. Why do these cysts happen? Do I have to worry about that? Is that a risk factor for anything like cancer or other diseases?
Yeah. Liver cysts, simple liver cysts are very common. Many people have actually more than one. There could be multiple cysts. Some of could be very large, but they are benign. They don't become cancer. So just leave it alone. Don't worry.
Great. Well, thank you for this lovely hour you've spent with us, Dr. So. It's very informative. The audience is very appreciative. I'm sure they've learned a lot. And I want to thank the Vincent V.C. Wu Foundation for sponsoring this series of talks, as well as Dr. So and the Asian Liver Center, as well as the Stanford Health Library. If you look at the chat, you can see a whole list of activities for the AAPI month, which is May right now, that have been sponsored by CARE. And this will be our last talk until the fall, but we do have a Stanford Big Ideas in Medicine conference. If you go to stanfordbigideasinmedicine.org, you can get information about that conference if you're interested in hearing about the latest in medicine. So thanks for spending the evening with us. Thanks again, Dr. So. Appreciate your time.
Thank you. Now you can go back to your Warriors game.
Yes, go back to the Warriors game. I don't know who's winning. Right.
Okay. Good night.
Good night.